Hello, good evening. Welcome to the virtual event. I'll just wait for a few more people to join and then make the introductions. You're in the right place. We'll get started very soon. Just see who's here. Good. People are joining. Welcome, everybody. So just a little introduction before we get started. I'm Alison Campbell. I'm Care Fertility's Chief Scientific Officer. I'm going to be hosting the event this evening. I've not done it for a while, so hopefully I'll remember how to drive. So what can you expect from the event tonight? So it's going to last for about 40 minutes. We've got 3 short information videos all about care fertility and our team. And I'm going to walk you through an IVF treatment pathway, right from consultation through to embryo transfer. I've got some really nice videos and diagrams to show you as we do that. And then towards the end, we're going to have a short question and answer session with a very special guest, Professor Charles Kingsland. He knows everything about everything. So we've had some questions coming in already, so we'll try and work through some of those. But you can also send questions in. Now, if you do that, if you ask them on the private questions tab, or in the you can either do that or in the public chat. But if you use the public chat, everyone will be able to see your first name. So it's up to you which way you do it. We'll be monitoring both. And if you'd rather send by email, you can do that too. It's events@carefertility.com. And if we don't have time this evening to answer all your questions, then we will reply via email as soon as we can. Same thing, if you think of questions after the event, then use that events@carefertility.com email. So I'm also very pleased to say that we have our new patient inquiry team available until 8 o'clock this evening. So you can ring them if you want to book and to come and see us, or you've got any questions and you'd rather speak to them directly. It's 0800 564 2270. So I'm going to start with a short video just to introduce you to care fertility. Share a video.
Family. It's who we are. And who we're always going to be. It's the important little moments. The big emotions. The beating heart at the centre of our world. It's the journey that we take there. Together. One step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualised treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that The clinic was only down the road from us, so we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic, and even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Oh, that's nice. I loved watching the patients speaking. So I'm going to go through now a short presentation. I've got some pictures and videos just to walk you through a typical IVF treatment cycle. So I'll just get those slides up for you. Okay. All right, so here we go. This about 1 in 6 people have issues, have difficulties starting a family, and at Care Fertility we believe that family is for everybody. We heard from the footage there, and we genuinely do. We try and treat every patient with dignity, and we care, and people come to us and we offer a whole breadth of treatments that I'm going to go through in brief. I mean, we haven't got time to go through the whole big toolbox, but I'm going to talk through some of the treatment types that we offer and how we go about it. So we've got clinics all over the UK. These are the locations, the newest one in Leeds. So we've got a big network of experts and clinics that we can pull together and really help fine-tune the treatments for every single patient. So this is Shah, and it's really easy to get started with Care. Shah we'll hear from a little bit later on. She leads the new patient inquiry team, and they're really friendly and knowledgeable, and they're going to be able to answer all your questions about treatment and getting started with us if that's what you wish to do. And we've got members of that team on the phones tonight till 8 o'clock. Right, so starting to walk through a typical fertility treatment journey, getting the right diagnosis and gathering information from you is a really important place to start, and that helps us give you the very best advice. And what we've got is a secure online portal where we keep all that information held together in one place. So if you've had previous test results, maybe through the GP or at a different clinic, or not, we've got this portal for every patient. So if there is information, it can be uploaded to that portal. So there's no need often to repeat any test that you've had in the past. All of this information is reviewed by one of our consultants prior to an initial consultation appointment. There's the portal. So just a nice picture to show this. You can access the portal on the desktop, mobile, tablet, really easy to use. This is George. He's one of our consultants based in our Sheffield clinic. And so here you go through at the initial consultation, listen to your plans and your wishes, and go through any treatments or tests that we've got from your record on the portal, and explain any further tests that you might need that may be beneficial to help us decide which treatment option, if any, are needed. And whilst the consultant is talking about the treatment options, they'll also talk through the chances of success. It's really important that we set the expectations and that patients understand what lies ahead and what their chances of succeeding will be. So our intention is that you go away from this initial consultation appointment with really detailed information about the treatment options so that you can consider those in your own time. And And you will know when you leave the consultation how and where to get support and how to contact us, and the cost of any treatments that you may have been discussing with the consultant. So whether your diagnosis is really simple or complex, we've got the depth of experience to give you this best chance and start to grow your family. So after your consultation, our clinic teams will answer any questions you've got. So we're really accessible, and they'll be able to put any information that you've requested or that we think may be useful for you for further reading or information into your portal. Now, getting started with IVF treatment, I'm talking mostly about IVF treatment whilst we do lots of other ones, intrauterine insemination as well, which are more simplistic. I'm talking mostly about the IVF process because this is what applies to the majority of our patients. So everyone's treatment clearly is different, but we pride ourselves in offering individualised treatments. So the treatment offering starts simple from intrauterine insemination and get through IVF, ICSI. I'm going to talk about that. These terms you've probably heard. Talk about a little bit about pre-implantation genetic testing and how we select embryos. So I'm going to cover quite a lot of information, but in simple terms, over the next 10 minutes or so. So ovarian stimulation is the first step. So we need to try in an IVF treatment cycle to collect a number of eggs. And this will give you the best chance because we've got a good number of eggs, we can try to fertilize them, and then we've got a number of embryos to select between, and we are really good at selecting embryos. So everyone's issued with a medication protocol, which one of our expert nurses will explain to you, all the drugs, medicines that you'll require during the treatment to get those ovaries stimulated. We will teach you how to do any injections, and really the nurses will be there to explain this relatively simple process. Some people do find it quite daunting, but most people find it very straightforward. They do the injections at home and then keep in touch, and we do some monitoring to see how that's going on. So there's Di, she's one of our nurses, and she's there explaining how to give the injections that stimulate your ovaries. And this monitoring phase, once you've started the injections to stimulate the ovaries, generally lasts between 3 and 7 days, but it's very patient dependent. And when we're happy with the number of follicles that is developing, each follicle hopefully contains an egg, then we'll ask you to have your final injection, which then matures the eggs. So these pictures is Rima from Birmingham. She's here demonstrating the ultrasound machine. So if you've had any fertility investigations already, you may be familiar with ultrasound machines. It's also the same machine that we would do pregnancy scans with. So these machines help us see how those drugs are performing, how the eggs are developing in those follicles on the ovary. So once we've suggested the follicles are doing well and we think it's time for the egg collection, we'll ask you to have a final injection to mature those eggs. Now, the egg collection is a relatively straightforward procedure. We use ultrasound again to guide a needle to the follicles on the ovaries to gently extract the eggs. It takes about 20 minutes or so, and it's usually followed by a short rest before you go home. So it's just a simple day procedure. If you're using donor eggs, then we would generally thaw those eggs around the time that the sperm is being produced. So not everybody will have an egg collection. So when we're doing IVF, we need the eggs and we need the sperm. And the sperm may be produced ejaculated, it may be fresh, it may be frozen, maybe from a donor. But generally speaking, we prepare the sperm in a very similar way, irrespective of whether it's been fresh or frozen or even surgically recovered. Now I think I've got a video. Oh, I have got a video. Just let me find it. It's really nice to see the sperm swimming on this little video here. Here we go. So we've got some quite sophisticated techniques to count the sperm and monitor them. We also look at the morphology, which is the shape of the sperm. So we do some quite detailed analyses on the sperm, which also helps us understand what the best treatment for you will be. Okay, just go back to the slides. It's like driving an aeroplane. Share. Okay, here we go. So the IVF process, so this is really where we bring the eggs and sperm together. It's very important. It's where we try and achieve fertilization. So IVF is where we mix the eggs and sperm. Both have been prepared in our experienced laboratories, and we mix them together in a little petri dish and leave them overnight. And then we'll assess for fertilization around 16 to 18 hours after we've mixed them. The other way that we can perform fertilization is called ICSI. I've got a video to share with you of this. Now, intracytoplasmic sperm injections, ICSI. So this is usually performed where we don't have sufficient sperm numbers or quality to perform conventional IVF. So you can see in the pipette there that's just gone into the egg, tiny sperm, and it's just going back now into the egg now. So we just inject a single sperm into each of the mature eggs. So it's really successful and well-established procedure. So they're the two main ways that we would achieve fertilization for you in our laboratories, by IVF or by ICSI. Fertilization is assessed the next morning, and we'll give all patients a call to talk to them about what we've seen and the number of eggs that have successfully fertilized. So once we've achieved the fertilization, we'll then keep the embryos in our specialized incubators for several days. And we want to generally keep them to the blastocyst stage. So this is the stage of embryo development where we see at least 100 cells and a fluid-filled cavity. So this picture on the bottom right-hand corner of the quadrant there is the blastocyst. So the top left is the normal fertilization, 2 pronuclei. And the one that says 45 hours, that's a 4-cell embryo. The next one, 64 hours, it looks like 8 cells. And then we continue to usually day 5, where we see a blastocyst. And most patients are fortunate to have a number of blastocysts to select between. So it's really important that we choose the best one, the one that's going to give the very best chance of a success. And if we've got more than one, then we can freeze some of the others, if providing the quality is good enough. So that's a really great benefit if we have multiple embryos. So I'm going to talk a little bit about the different ways that we at Care Fertility specialise in embryo selection. We've done a lot of research on this, because when we're faced with a number of embryos, we choose the best one. That gives us a faster time to pregnancy. So we've got 2 main techniques that we're very experienced at. We've got care maps, which is a morphokinetic way to assess and select the embryos. So we've got time-lapse incubators, and we're taking photos of the developing embryos every few minutes. And based on all this data and information that we've collected, we've built algorithms or models which help us choose the best embryo based on its patterns of development. So it's a completely non-invasive method of embryo selection. It's all about statistics, and we are leading the way with this technology. So we're very proud of it, and it's very successful. The picture on the right here is an embryo biopsy. So there's the blastocyst again that I spoke of. And in this picture, we're taking a few cells away from the blastocyst in order to test those cells for something called aneuploidy. So keeping it really simple, every cell has a number of chromosomes. But as women get older in particular, the number of chromosomes, the copy number of chromosomes, can be wrong. And if we don't have the right number of chromosomes, often we see a failed development in the embryos, or failure to implant, or even early miscarriage. So with this technique, which is particularly beneficial for women over 37 or so, but also dependent on other factors, but that's the main reason we would recommend it. We take a few cells, send to the genetics lab, we freeze the embryos, and we wait for the results, usually about 2 weeks, and we'll find out which of the embryos have the right copy number of chromosomes, and we preferentially transfer those. And the success rates then are as though the eggs had come from a much younger patient, because we're screening out the ones with the incorrect copy number. So also really successful. So the next thing, once we've selected the embryo, is embryo transfer. Most patients find this really exciting. This is where they get a real chance of a pregnancy, when we put the embryo back where it belongs, in the womb, in the uterus. So irrespective of how we've selected the embryo in our laboratories, whether that's by morphokinetics, by ChemApps, or by PGTA, which is the genetic methods that I was just describing, we transfer the embryos in a very similar way. So the embryologist loads the embryo into a very fine catheter. It's inserted through the vagina and the cervix into the womb. Just takes about 10 minutes or so. And after this, there's a 2-week wait for the pregnancy test. So a lot of patients are surprised how quickly it is before we do this pregnancy test. So we can detect a pregnancy within a couple of weeks of the embryo transfer. And if it's positive, then we'll ask the patient to come back for a scan so that we can look for a heartbeat. Now, if the pregnancy test is negative, then we offer support, and we do have counselling available. And we also arrange a follow-up consultation once our patients feel ready to discuss the treatment that's just taken place, and also to consider the next steps and what we want to do next. Just a little bit about donation, so egg donation and sperm donation at Care Fertility. We've got a very large team of donation experts and counsellors, and so we've got everything in place should our patients need to use donor eggs, donor sperm, or indeed donor embryos. The team has about 25 years experience, and some of our donation team members vastly experienced, and they've helped more people start a family than any other clinic in the UK. So we will support you through the whole process, right from initial questions to helping you select a donor if that's what's required. And if just a few more words about support, because it's really important that our patients understand that there's a lot of support there. It can be a very difficult process, but we offer free counselling appointments, and we've also got a buddy system. It's not for everybody, but some patients find it really helpful, where we can couple patients up who are at a similar stage in their fertility journey, and they can support each other as they go through. And we also hold online support groups. We've got a 24/7 online forum, so you can chat with other patients. And all of this is supported by the wider care team, of course. We're here to support you not just medically and emotionally, but also financially. And we've got Care Pay, which we've developed in-house, so it's exclusive to Care. It's individually tailored funding packages, and they're designed to give patients the financial peace of mind of knowing a plan is in place to fund the treatment if that's what they needed. We do also do NHS funded treatments. We've got contracts with NHS around the country, but some patients will have to self-fund, and so we can support with that as well. So we've got these 3 programs, the IVF multi-cycle program, and the refund program, and a donor egg program. So these programs all include egg collection, embryology, including the ChemApps, and embryo transfer and freezing. So we're going to move to our first Q&A, our question and answer session with Professor Charles Kingsland. So just a reminder, we've got our new patient inquiry team there if you need to speak to them until 8 o'clock. And please send your questions through on the chat or the questions tab, or of course by email. So we'll just wait for Professor Kingsland to pop up, and we'll start working through some of the questions for about 10 or 15 minutes or so, and then I'll come back and share some more information with you. Here we are.
Hello,
Welcome.
Professor Campbell. How are you?
Very well. Nice to see you. It's been a while.
It's been a while, hasn't it?
Yes.
There's a lot of questions here, Alison. I can't see questions 1, 2, and 3. It starts at number 4. So do you want to read them out, and then I'll do my best to answer the medical ones, and you do the embryology ones? How's that?
Yeah. All right. I can do that, and I can scroll. I can find question 1.
Okay.
Yes. Let's see. So we've got a question about what to expect from the first consultation. So just in brief, I mean, we've covered it a little bit. So we'll go through any information we've already got, and we'll do a gap analysis, really, won't we, and see what else we might need.
That's right. I think the important thing you have to remember about the first consultation, patients are often quite daunted. They've read an awful lot about IVF. There's a lot of anxiety. So the major thing is to alleviate the anxiety, to inform the patient about exactly what's going to happen to them, how it's going to pan out, but also what their expectations are and what the chances are of success. And you're absolutely right. What we try and do is explain where they've been, how they've got where they are, and where we want them to end. And an explanation, I always find it very useful that all the tests that you've had, you might have had a lot of tests, are explained in detail. So you have an understanding as to why you are where you are and what we're going to do to you. The other thing we have to emphasize is it's important for you, the patient, to have the opportunity to talk to us and tell us what your anxieties are and tell us what you don't understand. And by that sort of two-way dialogue, we can form a bond that will take you through the IVF process and hopefully come out at the end with the result that you want.
Perfect. Yeah. Let's just say a little bit about success rates, because we often get lots of questions about success rates, and it's really difficult to generalize because it's so dependent on many factors, on patient factors.
Yeah, you see a lot of examples of clinics who will say, "Oh, we are the most successful clinic in the world." It's a bit like saying, Marks and Spencer sell the best underwear in the world. That's all very well, but what you want to know is, what are the chances of you getting the result that you want? And there are a lot of variables. There are the age, your fertility, what's happened in the past, whether you've had any intercurrent illnesses, whether you smoke, whether you drink a lot of alcohol. All these factors will combine to give you an outcome at the end. And it's important that you know what your chance of success in that particular clinic. Most clinics will have a very similar outcome, but there are some that might be more attractive to you. Locality, for example. Can you park outside? Is it a big clinic or a small clinic? Is it a big NHS clinic or a private clinic? Do you get individualized care? For me, it would be important that the doctor or nurse that's looking after me knows who I am. It's also important to me that I can park outside the clinic. I don't have to spend lots of time trying to find a car parking spot, which may be expensive, which may be blocked. All these things add to the whole picture. There are certain factors that do give you a better chance of success. Age of the female is vitally important. The younger you are, generally speaking, the better is your chance. Body mass index, what your weight is. Weight is directly correlated to fertility. So your body mass index should be between a certain level to give you the best chance. Whether you smoke, whether you drink, all these factors, whether you've been pregnant before. So all these factors combine to give you an outcome. And at the end, you say, what are my chances, doctor, given these parameters? And hopefully you'll get the realistic answer to match your expectations.
Yeah.
Would you agree with that?
Yeah, no, that's great. I think that's the best thing is to get a really realistic opinion on chances of success. We need a consultation. We need all of the information. But in the meantime, if you really need some gauge, then you can ring us and we will talk you through in your situation and we can estimate. So I understand that people want to get an idea as soon as possible. So the best is the consultation room, but we're also available to advise in the meantime.
Yeah.
But there's a question about, sorry. Yeah,
Sorry,
there's a question. Care map. So yeah, we've talked about that briefly. One quick question saying, do we get a video of our embryo to keep? Yes, of course. We can put it into your portal. We can send a PIN number so that the transferred embryos video is available for you. So yeah, it's a really special thing to have, and most patients who have care maps really appreciate that.
I think I would also say that care maps that we do, which is unique to our group of clinics, is really good. It's very useful. Patients find it of great help, as do the doctors when giving a prognosis and outcome, because it sort of brings embryology, the mystery of what happens in the laboratory, into the clinic. So patients can actually see their embryos growing and developing, which is kind of nice.
It's magical, yeah, and it's getting better and better. We're learning all the time, and we're fine tuning, and we've got some big news coming soon on care map. So
yeah, exciting.
Yeah. So, is there this is a good question. Is there anything we can do to improve our results after our fertility assessment? So generally, what can people do to improve their chances of conceiving, either naturally or within an IVF treatment cycle?
Well, there are certain standard things you can do. Look after your health, protect your fertility. There are certain things you can do to improve your fertility, which we've just alluded to. Make sure your weight is as good as you can get. I know we always have difficulty losing weight, but at least try to get your down to as close as ideal weight as possible. Reduce, eat healthily. I'm not going to say stop drinking altogether, because life without alcohol I couldn't imagine, but everything in moderation. One thing you should do is give up smoking. If you smoke, there is no doubt that smoking has a detrimental effect on your fertility. Get plenty of sleep. Drink lots of water. Take the vitamins and minerals that are of benefit. There is one vitamin that is of undoubted benefit, and that is folic acid. Lots of others have a mixture of success. I would be skeptical on taking too many. Certainly, we advocate vitamin E, or some clinics will add vitamin E, but vitamin E for men especially is not always of benefit. In fact, some evidence suggests it might be of detriment. So before you start nipping down to the health food shop or taking nutritional advice, just be careful to get the right sort of information. I think that's that covers about 80% of it. Would you say, Alison, anything else you'd like to add?
Well, it's the one about the temperature. We sperm don't like to be too warm, so we say avoid hot baths, laptops on the lap, covering over the genital areas. Not really a good idea, because that can cause heat. So yeah, sperm are outside of the body in the testicles for a reason, because the temperature is lower there. And I think a lot of people don't really understand that. And when people bring a sperm sample in from home for analysis, sometimes they're tucked up in a hot water bottle, and we don't need that. We just need it to be near to the body. Just keep it room temperature approximately, and that's the best. Just
one other very important point as well, Ali. We see a lot of males nowadays who've got lowered sperm counts because they take nutritional supplements to aid their fertility, particularly anabolic steroids. And they may be great for your muscle bulk, but they are terrible for your testicles. And a lot you have to, when you're taking nutritional supplements to improve your fertility, just be careful what's in them, because some of them have traces of testosterone, which is actually not good for your sperm performance.
Good point. Quick one saying, is there a difference between fresh and frozen transfers in terms of success? Not really. No, there's some evidence that frozen is best. So we're completely confident with freezing embryos. And actually, when we're doing IVF, we will always talk to the patient about the possibility of us freezing the embryos and not performing a fresh transfer, because sometimes it's not necessarily safe or best to do it fresh. So
and this is what we go about individualized treatment. You know, some things are better fit for some patients. Maybe a fresh embryo transfer is good in patient in couple A, where a frozen one is better in couple B. There are pros and cons, but as you say, the outcomes in 2022 are very similar. That's different to what it was, say, 10 years ago, but the freezing technology has improved so much now. We can confidently say frozen embryos are every bit as good as fresh ones.
Here's a good one for you. Do we see an increase in the number of follicles when we use testosterone priming?
Well, if we did across the board, everybody would use testosterone priming. That's not the case. It certainly doesn't appear of unequivocal benefit. It doesn't appear in the NICE guidelines, for example, the National Institute of Clinical Excellence, who dictate or who give us a series of recommendations of what things we should be doing and what things are of doubtful benefit. They would not suggest that testosterone is a benefit. However, there are some clinics that would advocate it and promote it. I'm not saying that that's wrong. It's just that as long as it's of no deficit, as long as it's not detrimental to you, then you never know, really. So yeah, I'd just be a bit careful, but as you say, individual cases may differ.
Yeah. Here's a good question. So unfortunately, this patient's embryo transfer resulted in a chemical pregnancy. So there was a positive test, but there wasn't a fetal heart.
Yeah.
So in those cases, would you recommend to have testing of the remaining embryos? So they've obviously got some in the freezer.
Well, losing a baby at whatever stage can be devastating, and when you go through all the joy and expectation of having a positive pregnancy test and then it only to disappear within a few hours or days, that means that the embryo was stuck in to the endometrium, the lining of the womb, but for some reason has fallen away. Usually that's because the embryo was not genetically normal. The vast majority of early miscarriages are because of genetic abnormalities. Now, really, you can actually test genetically embryos. Whether you should or not is debatable. For example, if you have one spare embryo, you could argue, what's the point of genetically testing it? First of all, it can be quite expensive. Secondly, you're probably going to put that embryo back anyway. The only thing that the genetic testing will do, it won't tell you whether the embryo is going to turn into a baby, but it will tell you if the embryo is not going to turn into a baby. And that might be important for you. So, for example, if you've got 8 embryos, would you really want to go through the trauma of having 8 potential embryo transfers when none of them are normal? Whereas if you tested them and 3 were normal and 5 were abnormal, then you could actually pick those 3 embryos and put them back first. So it wouldn't improve your chance of getting pregnant with the 8 embryos, but it would bring your chance of having a baby forward and save you the trauma and the unhappiness of having to go through all those embryo transfers, which would be ultimately of no benefit.
Yeah, so I think it depends on several factors, but I can understand if you've had a miscarriage and you've got frozen embryos, and depending on your age, I think on the female age. So it's one of those questions that we would advise based on the odds, but we can test if it's 1, we can test if you're 30 years old. Everybody has a different tolerance and view, and so we will take it give the advice depending on the patient and factors in the number of embryos and all sorts of things, but we'll help you make those difficult decisions. So here we are. If you're, yeah. So if so, this patient couldn't have a fresh embryo transfer, so had all the embryos frozen. We were talking about sometimes it's not safe because if we've stimulated the ovaries and we transfer an embryo, we can cause a syndrome which isn't ideal. So we confidently freeze the embryos and wait for things to settle down. So how long would the patient need to wait between having that procedure and getting a frozen embryo thawed and transferred?
Well, it depends why you had the embryos thawed, if frozen in the first place. If, for example, it was because of ovarian hyperstimulation syndrome, the syndrome that Alison just alluded to, that can be actually quite unpleasant and in some cases quite dangerous. So it's best to recover from that. I would normally advocate probably 2 to 3 cycles after your egg collection and embryo creation before you think about having your frozen embryos thawed and one put back. It gives you a chance for the body to settle, all the hormones that have been circulating around during your egg collection to get out of your system, and then your uterus can grow, or we can help it grow, a healthy thick endometrium and prime it so that the embryo goes back at exactly the right time in that healthy endometrium. So in answer to your question, generally 2 to 3 cycles after your egg collection.
Yeah, let everything settle down. There's a question about embryo quality. I think it's we can talk generally about this. So we stimulate the ovaries, we get a nice number of eggs, probably 10 to 12 on average. Everybody's different, of course. Then we see that some of the eggs are mature, some of them aren't. They have to be mature to have a chance of fertilizing. So there's this cascade that I think sometimes patients don't fully understand. So they may feel disappointed if they don't understand that we're doing this to get a nice embryo for transfer. And anything more than that really is a bonus. So we get 10 eggs, 8 may be mature, 6 may fertilize, and they're thinking, oh, they're going down and down. But as long as we get a nice embryo for transfer and we use our sophisticated selection techniques, that's the aim of the game. So this patient had 9 eggs retrieved, 2 average quality embryos on day 5. So what are the reasons and what do we do next IVF round?
Well, what we do is we look at that cycle and see why were 9 eggs of the 9 eggs only 2 fertilizer mates day 5. There might be a number of reasons for that. It might have been the eggs were of not good quality or of variable quality. It might have the eggs were maybe a little bit immature when they're collected or over mature. It's unlikely, but that's we can sometimes get the maturation wrong. And why only 5? Well, it would be a bit disappointing because with 9 eggs, you'd expect probably 5 or 6 to fertilize and 2 to 3 to go on to day 5. But as Ali said, you only need one good quality embryo. And this story reminds me of going back quite a long time now, 15, 16, 17 years, of a couple who actually had 9 egg collections. And the first one failed, the second one failed. Then she got pregnant with the third, and then 4th, 5th, and 6th failed. And then the 7th, 8th, and 4th and 5th failed. And then she had a baby with the 6th, and the 7th and 8th failed, and she had a baby with the 9th. And at the 8th, I said to her, "Look, you've done more than you could possibly have anybody would expect you to. You've got 2 babies. Why do you want to go put yourself through another 9 cycle?" She said, "Well, first of all, I only get pregnant in multiples of 3. So I got pregnant with the 3rd, the 6th, so I need a 9th go. But also, I only get pregnant when I get 1 embryo. And it's 9 eggs, 2 embryos, one baby. 921, 921. And on the third and sixth go, I got 9 eggs, 2 embryos, 1 baby. And sure enough, on the 9th go, she got 9 eggs, 2 embryos, 1 baby. And we try and make science of this. I don't know, but what it reminds me to say is you only need one embryo. But obviously we'll look at that and try and improve it, because you've got 2 or 3 embryos. So, but every case is individual. And so what I would suggest is you go back to your doctor or your nurse practitioner, and they will go through with a fine-tooth comb what's happened and what changes we could possibly make to make the next cycle successful.
Yeah, perfect. Got so many questions. We can't say it right, but this one's quite a good one. We haven't mentioned AMH. So this patient has asked, what would be a reason for getting no eggs at an egg collection? It's very unusual. With an AMH of 11 and an antral follicle count of 18, 37 years old.
Yes, that is unusual. An AMH is a hormone, anti-Mullerian hormone, that is secreted by the cells that surround your eggs. The more AMH you've got, the more eggs you've got. It doesn't tell you about the quality of the eggs. The fact that you're 37 tells you about the quality. And then AFC is the antral follicle count. They're the little follicles, the fluid-filled sacs, in which the eggs mature, and they're around the periphery, antrum, the outside of the egg, outside of the ovary. The more antral follicles you've got, the more eggs you've got. Again, tells you nothing about the quality. But here we haven't got any eggs. So the first thing that I would ask this lady is, did she take her trigger injection at the right time and at the right dose? When the follicles are mature, and the eggs hopefully are mature, we give a final maturation hormone. Ganazi is the trade name, which finally matures the eggs and prepares them for fertilization after we've collected them. Now, sometimes that final trigger is not given, or you forget about it. It has to be given 35 hours before the egg collection. So that would be the first thing. There are a number of other things that you can that could have created this scenario. There's a syndrome called empty follicle syndrome, where although the follicles are there, the little fluid-filled sacs are there, the eggs just are not there. So all these things will be assessed, and you should be able to see your doctor or nurse or specialist, and they will be able to give you some idea as to why it's happened. You may know why it might have happened or have a hunch already, but the important thing is to ensure that it doesn't happen next time.
Brilliant. You know so much, Charles, and it's nice that you remember all these patients over the years. How long have you been in the field?
Well, I did my first egg collection in 1988. And you do, Ali, the thing about it is, you know, 34 years, you do remember cases, and patients will come to you, and you know, when you're a patient, you know, I've been a patient, not a fertility patient, but I've been a patient myself, and you think you have you're worried because you have a condition that you think is unique and nobody will know. And I often think that patients will come in to me and think, this doctor won't know what I've got, but I guarantee you I do, and I've seen it before. But the important thing is that once you've seen it, you remember it, and then I relate a lot of patients to other conditions and what we did then and how we corrected that and how we got the outcome. But you know, everybody's different, and I say, you know, if your chance is 1%, well, that's, you know, you've got to assess whether you're going to put yourself through that, you know, that chance of getting the 1%. But if you're that one, well, you know, and I've seen that before. I've seen patients who I've said, well, your chance is 1 in 50. And they've said, I'll take it. And, you know, and they've got a baby. And then they'll come back and they'll say, you told me my chance was 1 in 50. And look, and you think, well, we are. You were the one. You were the one.
Yeah. Everyone's a winner. Oh.
Everyone
we're talking about really unusual scenarios and cases where success rates can be low. Most of our patients have 30, 40, 50% chance of maybe it's
that's right.
And I think, and the fact that we have this network, and I alluded to this earlier, and we've got experts like you and in the medicine and me with the scientific, we've got such a vast experience between us, and everybody calls each other if there's an unusual case to say, what do you think? And so I think it's really special that we can do that. And
well, that's the beauty of working in a group like CARE. We've got 24 clinics, we've got 50 doctors, all specially trained in fertility. That's all we do. We don't do, other stuff. We're concentrating on the fertility of people come see us. We've got 150 embryologists, and so it's very reassuring that we can think, well, this is an unusual case. I know, Rima Ratchkaur in Birmingham, or Mr. Rutherford, Professor Balin, or in Leeds, they're specialists. I'll give them a ring so that you can get the best advice to give you the best chance of success.
Oh, lovely. Well, thank you ever so much for joining. I'm going to pop. It's been really good talking to you. I've got a nice short video. This has been prepared by Shah, and she's our new patient inquiry team leader. And she's going to tell everybody listening about how to get started with CARE and how we support you through treatment. And then we've got Dave, who's our CEO, who's going to briefly describe life at CARE and our dedication to supporting you. And then I'll pop back.
Have you finished with me, Ali?
I finished with you. Thank you very much.
Right. Well, you have a good evening. Good luck, everybody. Bye. Bye-bye.
I think I've chosen the wrong one. Sorry. Shah, here we go.
I'm Shah, and I manage CARE's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose CARE was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of, well, one size fits all, but with CARE that didn't seem to be the case at all. They took everything into consideration, they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you and, fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to care.
Oh, the support at care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
Looked after,
cared for by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some. And that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
So we are coming towards the end of this evening's session. I hope you found it useful. There's been a lot covered, and I understand that might be a lot to take in, but we are here. If you want to get in touch, we're here on the phones till 8 o'clock. I've just got one final short video to share with you. And just to say that thanks so much for your questions. We will email back or we'll contact you and respond to every question that we've received. And we hope to hear from you soon. Final video.
One in six people need help to grow their family. You're not alone. And our care family will do everything we can to help your dream of family come true. There are over 50,000 care babies in the world today, and behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are care.
Thank you very much. Have a lovely evening. Bye.